Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review books, review videos, Q banks, one on one sessions, and more to assist with nurses and nurse practitioners' success on boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know my disclaimer reminder I always like to go over is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines being tested on the ANCC as well as AANP exam. Now, any of my videos that you see that I may be teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a patient presents to the office with complaints of vaginal discharge. Upon examination, there's noted cervical motion tenderness. Based on these findings, what are the differential diagnoses? Is it A, chlamydia and gonorrhea, B, chlamydia and bacterial vaginosis, C, gonorrhea and trichomonas, or D, syphilis? Take a moment and tell me what you got in the comments, you guys. All right, so I always recommend reading the stem of the question first, so it allows you to slow down to ensure that you're answering what is even being asked. So here, the stem of the question states, based on these findings, what are the differential diagnoses? Now, y'all know I always tell you if they're asking for a diagnosis, you need to run it back and look at the assessment findings so that you can break down and see what is actually going on to come up with a diagnosis, right? So this patient came in complaining of vaginal discharge. Upon exam, the nurse practitioner notes cervical motion tenderness. So when you think of cervical motion tenderness with an associated vaginal discharge or any type of discharge, you want to think chlamydia and gonorrhea. Gonorrhea, more specifically, typically has a greenish discharge, but both the cervical motion tenderness and discharge are common presentations for chlamydia and gonorrhea. So A was your best answer. All right, so question number two, the nurse practitioner has chlamydia and gonorrhea as the differential diagnoses. Which test should be completed to confirm this diagnosis? Is it A, cervical swab, B, a blood draw, C, NAT, or D, none at this time? Take a moment and tell me what you got. So, stem of the question here is which test should be completed to confirm this diagnosis? So, when we are looking to confirm chlamydia, gonorrhea, and most STDs/STIs, the proven gold standard diagnostic exam now is C, your NAAT, also known as NATs. Okay, so C is your best answer. All right, and question number three. Chlamydia has been confirmed as the diagnosis. While reviewing the patient's history, it is noted that she has a macrolide allergy. What is the best treatment? Is it A, Bactrim, B, azithromycin, C, doxycycline, or D, amoxicillin? Take a moment and tell me what you got in the comments, you guys. All right, so here's the stem of this question. What is the best treatment? So again, if they're asking you about a treatment, you need to run it back and see if they have provided you with a diagnosis. If they have not provided you with the diagnosis, you need to take it back a step further and look at the assessment findings so that you're able to determine the diagnosis so that you can then determine how to treat that particular diagnosis. But in this case, they have provided the diagnosis where chlamydia has been confirmed. So with chlamydia, you need to know those first line therapies and how to utilize and treat this because commonly the question is about co-treating with gonorrhea, and we'll get into that. I've done some videos on that if you struggle with those areas. But a few things to break down. Chlamydia, think how you treat. Then also is notice that there is a macrolide allergy. So first line therapy for chlamydia is doxycycline and azithromycin, right? But azithromycin is a macrolide, ends in myosin, macrolide, right? So you can eliminate that. So the best answer choice here is C, doxycycline. Now, as far as co-treatment, we would need a little bit more information because on the last one, it talks about having gonorrhea and chlamydia as differential diagnoses, but here chlamydia has been confirmed. So you only need to treat this. If they would have told you that the results were pending on the gonorrhea results, or that they both were positive, then you would co-treat. And we typically go with that Rocephin treatment, as you can utilize that for both. Okay. But again, it's so many parameters as guidelines have changed. So I'll do some more on that so that y'all can see it in different steps, because a lot of my one-on-one students get confused because it's really based on the wording when you're determining how to co-treat and when to co-treat. So I'll do that sometime in the next upcoming week to kind of explain that a little bit further for you so you can see it in the question format. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But make sure y'all meet me back here. If you need any of the resources that I offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot an email to us at the nursing studio, the number one, at gmail.com. The things that I do offer are my review book. You can get it in an ebook fashion or paperback option. They're both linked in the bio of this channel. You can get the self-paced review if you prefer reviewing on your own independently. This review is designed and broken down by system. It's designed for family as well as adult Gero preparing for either the ANCC or AAMP exam. There is a complete non-clinical portion also in this exam. In this review, I'm sorry. And there are videos for each, so you can watch them over and over to help you study. And that's linked in the bio of this channel. If you prefer a group review, our 5-week review, the final one for this year, starts September the 9th. There is one space available if you're looking to join. The link is in the description of this video. It's 5 weeks, starts September the 9th, ends October the 18th. Then lastly, two other things. My QBank options are also linked in the bio of this channel. I have them broken down in several ways. You can either pick particular bundles that fit your studying style and where you are, or you can do the entire bundle to get all of the options. So they're all linked in the bio of this channel. And then my one-on-one sessions, I always say just reach out to us either by phone or email, because all the one-on-one sessions are customized based off of what you need and when you're looking to prepare to study and test. So I always say reach out so that we can determine which option is best for you. But there are 3 different tier options. You can book a session for your weaknesses, so 1 to 2 weaknesses to be covered per session. You can book an exam readiness assessment, or lastly is the customized review with the one-on-one sessions as well, that you're able to book those over several weeks or 1 week or 1 day. It depends on what you truly need. So I always say reach out so that we can engage what's truly needed for you. All right, you guys, as always, make sure y'all meet me back here. Happy studying. Bye, y'all.